Do you know if Jason is that, not yet? Okay, well, it's 7, we'll call the meeting to order. You, join me for the Pledge of Allegiance. I pledge of allegiance. United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We unfortunately have another member, Ed Daltario, that was a member of the Strategic Planning Commission, former member that has passed away. So if you could just join me in a moment of silence for Ed Daltario. Thank you. Next up is the presentation from the Housatonic Valley Health District. Amy?
Hi, everyone. Good evening. My name is Amy Bethke. I'm the Director of Health for the Housatonic Valley Health District. I have some slides to present to you folks tonight, and I did also print some for the members on the board.
Thank you.
Is the mic on up there? Oh, I can check that. Thank you.
So Amy did come to me, gave me a good presentation to look over, so I invited her tonight to present to the town of Southbury.
Okay. So it's been a little bit since I was here, so I'm going to kind of take a step back and explain really what we do as a health district. I think oftentimes we hear public health, and I know when I was going through my master's program, day to day in my career in my office, folks don't always know what public health is. So I'm going to try, Bonnie, I might ask you, Betsy rather. Sorry, Betsy. Thank you, Betsy. Perfect. And we can go to the next one. So we have the really granular CDC definition. Public health is the science of protecting and improving the health of people in their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. Really what this means at a higher level is that we're charged with being experts on our communities. We want to know the demographics of our communities. We want to work closely with the folks in town hall, the boots on the ground, the community-based organizations, and make sure that we have our finger on the pulse of how the community is doing from a health perspective, and we can offer programs that meet the needs of that community. Next slide. What we're tasked with at the state level is providing the 10 essential services of public health. This is a framework that includes things like assessment, policy development, and assurance. What this looks like on the local health level is oftentimes doing things like lead investigations. So we actually go into folks' homes if we have identified a child that is lead poisoned, and we will evaluate the home for any lead paint risks. We also go into restaurants. We routinely inspect all of the restaurants in your community to make sure that everyone who is operating on the restaurant level is doing so in a safe and effective way. We go to temporary events, so you may see us at any event where there's a food truck or food is being served, because again, we want to make sure that we're doing things in a healthy manner. We really have 3 sides of the house. One focuses primarily on community health, and that's really our folks who are charged with offering things like immunization clinics. You may come to us for your flu shot each year. We also do childhood immunizations. Our environmental health folks do some of that other work that I just mentioned, so the lead inspections, the restaurant inspections, and then we focus and we work closely with Steve Schnell, who's fantastic here at Town Hall on this, for emergency management as well. Thank you. And this is just kind of a larger step back about foundational public health services. So we also manage communicable disease control, and we make sure that, again, we have a sense of any chronic disease or infectious disease that's currently occurring in the community. So when things like tuberculosis occur with our community members, we actually do contact tracing, and we also provide directly observed therapy. So we follow that person for the next 6 months, and we make sure that they're taking their medications as prescribed. And this applies to other types of infectious diseases as well. So again, we really want to make sure we monitor and we're able to contain any type of infectious disease spread. So here we have some of the history of health districts in the state of Connecticut. As we can see, the first annual report of the Connecticut State Board of Health in New Haven was formed in 1878. Then in 1878, sorry. Then in 1887, Connecticut state law required the establishment of local boards of health. Fast forwarding to 1996, the current structure of public health districts was rolled out at the state level. An Aspetuck Health District, which oversees Westport, Weston, and Easton, was actually the first one that was formed. And here, present day, legislation has been updated over time to reflect needs and services, rather, of the growing and governing statute. So as we can see here, most of Connecticut is served by health districts. All of the districts oversee the towns that are colored in blue. Full-time health departments oversee the towns that are covered in green. And there still are a few part-time health departments, and really those are populations, or towns rather, with smaller populations that are highlighted here in green, or in gray rather. Okay, so about HVHD specifically. So we currently oversee 6 towns. We go all the way up to Sharon, Connecticut. We oversee Washington, New Milford, Woodbury, here Southbury, and Oxford as well. We are a full-time public health department that serves the 6 towns that I just mentioned, with the goal of providing a healthy environment, advocating for health and well-being, and preventing disease within each of our communities. We're governed by a board of directors, 3 of whom are from the town of Southbury, with representatives from each of the 6 municipalities, in proportion to the population of the town. The district has offices both in New Milford and here in Southbury as well. Our current population is just under 79,000. Here we can see some of our community health profiles. So here in the town of Southbury, the population per capita is just over 20,000. The land area is 39 square miles. Median household income is $112,434. There are a little over 8,000 households, and the median age is 52.4 years. And this is really crucial information to know as we're evaluating the community, and it really helps to shape some of our programming and the appropriateness of our programming for fitting our specific communities. Here we have outlined HVHD's mission. The mission of the Housatonic Valley Health District is to create better health outcomes and promote the highest attainable standard of health. This is accomplished through 3 principles, which include prevention, education, and outreach. So what does prevention mean? Prevention means averting disease, injury, and disability through regular inspections of public and private businesses and homes as applicable to ensure conditions exist where people can be healthy. Education is also a major component of what we do, and we do this out in the community when we have our Healthy Chat series, where we have our nurse go to different community centers and senior centers, and we provide education outreach through different social media platforms as well. So with regard to education, we inform the public and health practitioners on public health best practices, policy information, and the impacts and methods of prevention for the spread of communicable diseases. And lastly, outreach. We engage community members that experience obstacles in accessing the public health services that they need. We deliver different types of services, including vaccines, to the community, and we advocate for needed and beneficial health policies. Our vision is to promote a culture of health in each of our communities, to enable accessibility to all services, provide the highest quality of public health leadership and services, to create better health outcomes through the prevention of disease and injury, and lastly, to promote policies that enable longer and healthier lives for each of our community members. Community first is a major value for us at HVHD. We do not treat all of our communities the same. We understand that they are all different, and because of that, we tailor our programming to each of our communities. There's no one-size-fits-all approach. We also pride ourselves on professional service. Whether we're administering clinical health services like our vaccination clinics, we're inspecting businesses and homes, or assisting the community with some administrative needs, we always make sure we're maintaining the highest level of professionalism and customer service. It's our job to get you the answer to your questions. We don't want to leave you with more questions than you had when you initially spoke with us. And I think we are successful at that. And then inclusion, equity, and accessibility. We believe health and access to public health services is a human right, not a privilege, and will always foster an environment of kindness, compassion, care, and respect with a goal of inclusion and equitable treatment amongst colleagues and the public. We make sure that when you come into our office, whether it's for maybe you're adding a pool on your house, maybe you're adding an addition to your home, and that's some of the environmental work we do, maybe we're giving you a flu shot or we're taking your blood pressure, we want to make sure you're treated with the highest level of respect. Here's some information about our financial structure. So I won't go too much into this, but just to share how we're funded, health districts function as a nonprofit governmental entity. Our fiscal year starts July 1st and ends on June 30th. We receive per capita from members, so that means we set a per capita dollar denomination on an annual basis. And for each member of the community, we charge that per capita to each of our towns. We also receive a portion of our funding from the state. We receive dollars from grants and then fee for service as well. And that's mostly tied to our environmental work. I think we can skip this one, Betsy. And this one probably too. So what are the benefits of being served by HVHD here in Southbury? We deliver evidence-based community health programs. I'll go into those in a minute. Local vaccination clinics that are right here in town. We come to your senior center, we come to your town hall. Our office is right here on Playhouse Corner above the Dunkin' Donuts is how we always tell people where we're located. And we have multiple different vaccination clinics there as well, in addition to Pomperaug High School. We offer those high quality environmental health services. We do offer 24/7 emergency access to staff expertise. So that means when you are a mom who is a child and you're concerned about a tick bite and it's 10 o'clock on Thanksgiving, night before Thanksgiving, we will answer the phone. We will make sure you get that answer that you need. And we want to make sure you can care for your child in the best way possible and you're getting the services and responses that you require. We also have an innovative approach to digital monetization, and I will go into that as well. We've updated our website recently, and we have some updated and improved services that help the community with some of the environmental work that we do as well. So here are our community health programs. We're fortunate to have some great help in the space of social media and communications, and we're really putting out some nice flyers and social media posts, especially as of late. So some of our community health programs that we highlight here are free radon test kits. This is something that's still ongoing. We encourage all members of the community. We actually live in the portion of the state that's called the radon belt. It's very important that you test your home from radon every other year. In fact, 1 in 4 homes in the state of Connecticut has elevated levels of radon. So please come on by to our office, and we will give you a free radon test kit, very easy to use. You can sample right in your home. We also offer a program called Impact Teen Driving, which is a helpful program. It teaches teens how to drive responsibly. And the class is actually, it includes both teens and their parents. So it's a kind of a group learning experience, which we found to be very effective. We also offer childhood vaccine clinics. As I'm sure we're all reading in the news, measles is a major public health concern right now. So offering MMR vaccines in addition to other childhood vaccines is a priority for us at HVHD. We also offer a class called Matter of Balance to our senior center population. We have folks that are very interested in taking this class. We offered it, I believe, once over the summer, and we're planning to offer it now in the spring as well. It's a class that's focused on empowering older adults to prevent falls in their home. Our healthy chat, so every month we have a healthy chat, which I mentioned our public health nurse, Heidi, who's fantastic, goes out to our senior centers, goes out to our community centers, and delivers a chat on a specific topic. This month in particular, the topic was seasonal affective disorder, and those change based on related topics for each month. So for example, in October, our topic was focused on breast cancer, and then coming in February, because it's Heart Health Month, we'll be focusing on some heart health topics as well. We offer mental health first aid and virtual Narcan and QPR training, which is great because that's a really accessible format for folks. They can join. Typically, we'll do them on Saturdays or after working hours, so we can really, boost the number of folks who are able to take advantage of those programs. Here is some of our educational social media posts that we create. So we wanted to make sure, as news was coming out at the federal level, that there may be some changes with regard to the vaccine schedule. The news that we were getting from CTDPH was that there would not be changes to the vaccine schedule here in Connecticut. We wanted to make sure we got that news out loud and early. So we did social media posts across all of our platforms regarding the vaccine schedule for children. We also routinely post about lead risks that occur. So unfortunately, lead can contaminate anything from cookware to different products. Typically, they can be products that you buy on some online retailers that that we all frequent. So we want to make sure as that information gets pushed out to us from the FDA, we're making our communities aware of that as well. When below freezing temperatures are expected, like unfortunately we've been experiencing for the past couple of weeks, I hope it warms up soon, we have some posts about winter warning. We share with the community that below freezing temperatures are expected, and we share how they can go to 211ct.org for warming shelter locations. We also post about different respiratory virus case updates, so how we're trending this month as compared to months previous and in comparison to years previous. Unfortunately, we saw a major uptick in flu this year, so that's important. We want to remind everyone to make sure they're getting vaccinated for the flu. We still have some extra if you have not gotten vaccinated yet. And we want to make sure the community is aware of what to be cautious about. We also have some emergency information, so if it's very cold, you experience a water main break, potentially we have information from Aquarian, information from Eversource, Optimum, Spectrum, Frontier, all the providers that our community members are used to interacting with. Some additional information regarding those radon testing tips. And again, because there was some confusion about the guidance that was going on about the COVID-19 vaccine, we shared some additional information on the COVID-19 vaccine as well. Community Health Profiles Dashboard. So Betsy, I'm actually going to ask you to click on that picture if you don't mind. And this link will take you to our website. If you scroll down just a little bit, this is our interactive dashboard that we created for each of our communities. So if you scroll down just a little bit more, perfect, and now up a little bit, sorry, Betsy, and you click on health outcomes. No, this is, scroll a couple blocks over to the left. Perfect, yep, awesome. So what you'll see here is an interactive dashboard. If you see the short question text right up there, it says cancer, non-skin, or melanoma is the one that we selected. If you click on that drop-down, we'll be able to filter by a number of different types of health outcomes, and we can see the rates of these outcomes in each of our communities. In order to create these profiles, we source data from the CDC, we source data at the state level, and source data at the local level to make sure we got the most comprehensive picture of all of our towns. So in Southbury specifically, if we go to high blood pressure, this is something that we want to make sure we focus on for the town of Southbury, because as we can see, the rates are a little bit higher than in some of our other communities. And we can go to high cholesterol, Betsy, as well. And this is something we all hear about often. We want to make sure we're exercising, we're eating healthy, we're doing all the things so we can maintain a healthy lifestyle. So that plays right into high cholesterol, plays right into high blood pressure. What we offer at HVHD in terms of each of these different types of health outcomes are education, like I mentioned, with some of our information that we push out on social media. We also offer blood pressure screening at the senior center. It's also available in office if anyone's interested. And what we do with that information is we work with the community member themselves. If they're interested, they can report that blood pressure rate back to their doctor. So it's really helpful because we can screen them once a month and they can share that information with their doctor. If there are any concerns that they're seeing month over month, we have that information. We also have giveaways, so we have something called a pulse ox that can measure oxygen saturation. This is a vital sign that can signal different types of health issues, so we have that as a giveaway in office. And we also run different types of programming. Last year was actually our first year of doing the community walking challenge, but it performed so well with all of our communities, we're planning to do that again this year. So we walked with folks from the senior center, we invited folks across the community to join us on this walking challenge, and we gave everyone who participated a pedometer, and we turned it into kind of a fun, competitive event for anyone who wanted to join us. So it was fun. We participated in walking day together, and we had a nice group involved. So it was definitely something that we'll offer again this year. I think, yes, let's go back to the PowerPoint. No, it's okay. Perfect. So like I mentioned, a big part of our offerings on the community health side are annual flu clinics. This year we administered over 1,000 vaccines. For our public clinics, we administered 343. And our private clinics, which include things like senior centers, town halls, et cetera, we administered over 700. We want to make sure we're keeping track of how many we're giving, both because we want to understand demographically how we're participating in terms of rates of vaccinated folks in the community, understanding that folks are also getting vaccinated from other sources. And from a financial perspective, when we do our budgets every year, it's very important to understand how the return is on insurance rates for vaccines. We are taxpayer funded, so we want to make sure we're using your money wisely. So this is now going into some of our dashboarding that we have for environmental health services. So like I mentioned, we often do things on the environmental side of the house with building and septic. So we can see for this year, and this is going back, I think, to last month, so we're lagged a little bit behind here, but we have had 792 applications submitted in total as of the month of January, which is an increase of 9.7% over the year prior. We also track the different types of applications we receive, things like building applications, soil tests, subsurface sewage disposal, which is always hard to say, plan reviews, permits to construct, permits to discharge, and wastewater treatment services. So again, we just want to make sure we're tracking all of this over time, we're understanding how we're trending as opposed to years prior, so we can accurately predict work and services required going forward. And we have some trend data here as well. Okay, and I think we can go to the next one, Betsy. And then what's the most important thing that we focus on when you're submitting an application, right? How quickly my staff is able to get to that application, how quickly we're spending time reviewing that application, when we're turning that around and getting it approved back to you, and getting answered any questions that you have. As we can see in 2020 or fiscal year 2023, our turnaround time for applications was 3.63. Now, if you fast forward to fiscal year 2025, our average turnaround time is 1.75. So we are very quick at reviewing applications, which we pride ourselves on as well, and we want to make sure, again, that we're getting folks in the community answers to everything that they need so they can quickly perform any work that's required on their property. I'm also fortunate enough to have very skilled sanitarian staff. I have 2 members of the staff who combined have over 60 years of service. And I have 5 sanitarians in total, which I brag about at the state level because unfortunately there are not many sanitarians to go around. And here is the sum of service type and average turnaround time by month. So again, just kind of tracking that information month over month. And just backtracking to the benefit of HVHD, like I mentioned before, staff expertise. So community members have direct 24/7 emergency access to staff with a wide variety of backgrounds and areas of expertise. So if you're dealing with a water contamination issue, unfortunately, I know we experienced some flooding here. What was that, a year and a half ago now? My group was boots on the ground here in the community so we could address any issues that folks were experiencing. We offered discounted well water testing to anyone who may have had a contaminated well. And I also have a fabulous nurse who's available to answer community health-based questions as well. With regard to digital monitorization, we have updated our website. Hopefully, although we definitely appreciate receiving any feedback, we have updated it so it's more user-friendly. So when you go to the website right away, on the left, you can see the application form library. We can search property files, or we can request a vaccine appointment. These are really the primary services that we find that folks come to us for, although we have a lot of different type of information on the website as well. So that community page is where we house that community profile information I spoke about earlier. We walk through each of our different types of programs that we offer. We have an event calendar that showcases each of our events, and we offer a monthly newsletter that is sent out, and all of that is accessible here on our website. Here is just a sneak peek of what our form library looks like. We have different forms for many different types of services. So we have forms for food establishments, sewage disposal, building forms, private well permits, et cetera. So all of that is easily accessible here. If folks have a question about how to fill out a form, you can always come into our office or just call our office, and we're happy to assist you in doing so. If you were to click on food plan review application, for example, if you owned a restaurant, what you're able to do is just click that button, then click on begin application for food license plan review, and it actually has the form embedded right on the website. You work to complete it. Again, you could reach out to us if you have any questions, and when you hit submit, it's triaged right to my admin staff, and then it gets triaged to my sanitarian staff, which helps with the seamlessness of transition of some of the paperwork, which has also helped us cut down on turnaround time. And here's just an example of what that embedded food service plan review application looks like. And this is the new portion of our website that we're still working on. We have town searches available. So oftentimes if you're selling a home, if you're maybe looking to purchase a new home, or if you're interested in where your septic is located, where your well is located, you may be curious to see your property file. Those property files are a matter of public record, and because of that, we are working to publish those each on our website. So if we click on, for example, the town of Southbury, what we will do is that will bring us to a form where we can type in our address and it will pull up the property file that we're looking for. We're still in the process of adding all of the property files that we have in our office, which if you've been to our office, we have many, many different file cabinets where all these property files are currently housed. We're working on scanning them into the system, so all of them will soon be accessible to members of the community. If you're curious on how a restaurant has performed on a recent inspection, maybe you want to go out to eat and check on how your favorite restaurant is doing, you can look at the town of Southbury and search for a restaurant as well, and you can see that inspection here on the website. And that's it. So if anyone has any questions, please do go ahead and contact me. I also brought extra cards, so I'll leave them on the table here if anyone would like to grab one. And always, please feel free to reach out via email or phone.
Thank you for that presentation. I do have a couple questions, just because when you did come in, you did drop off this community profile report, and it's a survey done in 2021, and looking through it, there were a number of areas: diabetes, high blood pressure, physical health, cholesterol screening, and routine checkups, that Southbury was highest on the list on those, well above average. I just want to know what we could do to better get the message out, to get people some information on how they can improve on this, and what we need to do as a town.
Absolutely. So prevention is a very big component of public health. So what that means is we want to make sure that in our folks who have not yet experienced high blood pressure, have not yet experienced things like high cholesterol, like you've mentioned, we can educate them, we can provide them with resources, we can encourage them to exercise, things like that, to hopefully prevent some of those negative health outcomes. For our folks that are already there, we can do active intervention. So again, we would encourage folks to follow us on social media, get some of those educational interventions, do things like participate in our walking challenge, take advantage of coming into our offices to get blood pressure screened, or if you're a member of the senior center, we can do it there for you as well. We're currently in the process of developing some additional programming. We're looking forward actually to updating our community profiles dashboard, because the next round of data recently was released by New Vance Health. They do a community health needs assessment for this community and some of our other communities on a 3-year basis. So we'll continue to monitor some of those numbers. We'll share that information with the town. And as we develop new programming, we'll share that with you as well.
And how often does HVHD give programs to our senior center?
On a monthly basis.
So that you are there monthly. Just a couple other questions that I had. I was happy to see that the building and septic turnaround is way down from a couple years ago. I think that was a big issue that we had a few years ago about not getting it. So that's just from the increase in sanitarians that we have?
Yes.
And you did mention measles. I know there was an outbreak, or someone came down with measles in Fairfield County. Have we had any reports of any measles in New Haven County?
Fortunately, no. But we still want to make sure that we're remaining vigilant. Contact tracing is important. I know it was important. It was an important part of that individual diagnosis. And making sure that, again, we're getting education out there. We're vaccinating any children who are unvaccinated to prevent any measles spread is very, very important. We're fortunate here in Connecticut. We actually have the highest rate of measles vaccination in the country, which is really fantastic. And that's because some of the public health policy that exists to encourage children to get vaccines is appropriate. So we're very proud of that as a state, and we want to make sure that we continue that.
Okay, thank you. Do any board members have any questions?
I do. I just wondered, thank you, this was really insightful. Was there any study done as to, particularly in Southbury, why we are experiencing those higher numbers in the areas that you showed?
So I'm happy to take a deeper dive into some of the data and try for you. I think there's so many different contributors to some of those health outcomes that it may be tough to kind of put our finger on exactly what maybe the issue is. But my staff and I can look more closely into that data, and we'll see what we can get for you.
Thank you. I was just thinking that would be helpful as you were, responding to the need for community outreach. If we sort of understood what were, the preceding factors, we could maybe more effectively communicate that. So thank you.
Absolutely.
I just wanted to comment, I had the opportunity to work with your office prior to the Southbury celebration, which unfortunately was canceled. But I actually did fill out the applications and called about 400 times to ask a million questions, and it was lovely working with your team. So thank you. It's really come a long way in a couple of years, so it's noted and appreciated.
Thank you.
Anybody else? Well, thank you, it was a great presentation, appreciate it.
Thank you for having me.
Do I have a motion to approve the consent agenda?
So moved.
Thank you, Holly. Second?
Second.
Any discussions? Those in favor signify by saying aye. Aye. Opposed? Abstentions? Motion carries. Moving down to bids and procurements. Can I get a motion to approve the bids and procurements?
So moved.
Thank you, Wendy. Can I get a second?
Second.
Thank you.
Kathy.
Any discussion? Kathy? I'm sorry. Any discussions on the bids and procurements? Those in favor signify by saying aye.
Aye.
Opposed? Abstentions? Motion carries. On these bids and procurements, the pedestrian safety improvement, that's the library sidewalk that's going to be finally finished, and also the Southbury Green crosswalks. Transfers, can I get a motion to approve the transfers?
So moved.
Thank you, Kathy. Second? Thank you, Holly. All in favor?
Aye.
Anybody opposed? Any abstentions? Motion carries. The minutes for the January 15th, 2026 regular meeting. Can I get a motion to approve those minutes?
So moved.
Thank you, Wendy. Second?
Second.
Any discussion? I just have one amendment. Maybe I should have mentioned this ahead of time. There's one small amendment to it. Let's see, the Larkin Bridle Path, Betsy, the discussion on the Larkin Bridle Path, we had down the date of 2022. It should be 2023 that those recommendations came in. So a motion to approve as amended. Let me redo that. Can I get a motion to approve the amended minutes for January 15th, 2026? Wendy?
So moved.
Wendy? Thank you, Kathy. All in favor signify by saying aye.
Aye.
Aye. And anybody opposed? And it carries. Unfinished business, we have on unfinished business a couple items, the economic development discussion on economic development director. It was the recommendation of the Board of Finance. They suggested to have somebody to do this role for 10 to 15 hours. We are reviewing that, and hopefully it'll be posted soon, and we'll have a resolution to at least add someone for a part-time basis for 10 to 15 hours. The second one has been the ARPA fund reallocation discussion on the request from Park and Rec to reallocate those ARPA funds. There's 183,000 still left in ARPA funds, and the Park and Rec Commission is going over numbers. They came back with a few. One of the larger one was to pour rubber ground buffer, and that was like 90,000. We're still waiting on some other numbers for the park improvements for Ballantyne Park and Settlers. So once we have those in, we'll have a resolution for that. did,
Can I ask a question on that?
sure, go ahead.
So we had talked about whether or not those funds being reallocated, there was definitely going to be no progress moving forward on a splash pad. Do we even know what a splash pad would approximately cost, and like how far off are we in a gap? Because I'd love to obviously see both things happen. When we're talking about numbers as big as $90,000 for the rubber barrier, like I just still really want that other piece for our people, and I'm just curious how far off we are.
There were actually no numbers done, but splash pads do have a range. I mean, you can get splash pads from $100,000 to over $1 million. There was no really deep dive in it. Park and Rec a few years ago did want to do a splash pad. They ended up, from reading through the minutes, looking at other towns that do have splash pads and were concerned with health reasons to put a splash pad in. So they ended up just taking that off the table and wanting more so to be more inclusive in our parks and playgrounds, so wheelchairs can access the playgrounds more. So that was up to the Park and Rec Commission, and the splash pad has been taken off the table by them.
Thank you for that information. Makes me sad, but thank you.
Yeah, next up was the the Larkin Bridle Path discussion. So I have been in contact with Naugatuck Valley Council of Governments, the DOT and DEEP on the crossing on Route 6. That was a major concern for a number of people on that. As we had the discussion, there was a recommendation back in 2023 to put in the flashing beacon light there. And hopefully we're going to be going through with that once the weather cooperates. Did have some correspondence from actually Ann Armino, and she was concerned, and she wanted to be sure that we also installed a warning light about 1,000 yards back from that crossing, so we don't have any rear-end accidents. So that was brought up also by to the Naugatuck Valley Council of Governments, DEEP and DOT. And the strategic plan force discussion. This again was still on unfinished business. We were looking to reestablish the strategic plan commission. Had some excellent feedback from a few individuals, and there is a handout that we went over, discussed some of these points with prior members of the Strategic Planning Commission, and the feedback was very good. It was great that people are interested. Heard some excellent feedback. We listened to selectmen and women, met with two former strategic plan members, Joe Rosario and Fred Sell, and we came up with a limited scope with a duration of possibly 6 months, and a lookout time of 3 to 5 years with objectives on maybe 3 to 5 objectives noted per year. No more than 4 strategies each, and priorities would be the Board of Selectmen. They would choose the priorities. Establishing a task force with 6 members total. Alternates would be atypical, but do want to hear back from what some other selectmen feel on that. At least 2 Board of Selectmen members, 1 Board of Finance member, 3 members of the public, and we will do anyone that's interested, a reach out for that. So if anybody would like to add on to this discussion, hopefully we'll have a resolution, our next meeting on that, to establish that task force. If I don't hear anybody with any discussion.
Just a quick question. Like, normally when you have alternates, it's to make sure if somebody can't make it, the meeting goes on. Like, for a commission, I know you have to have so many members or you can't vote on anything. The task force is different? It's not as strict?
Well, an alternate would be if some member didn't show up and there wasn't a quorum, we could seat the alternate, so there would be a quorum.
So that's why an alternate wouldn't be a bad idea, so that you always have a quorum, so you don't have to worry about missing a monthly meeting because somebody's on vacation or whatever.
Mhm.
So I would think at least one alternate wouldn't be the worst idea.
Okay. Anyone else?
I just want to thank you, Tim. The 6-month duration, I'm happy to see that, so I really appreciate that. I think that's reflective of supporting the new administration, but also recognizing that the task force, the removal of the task force was part of the charter revision, so 6 months, I think, is very fair, and I appreciate that.
Yeah, the commission, removal of the commission, so. I really think it's needed for the town of Southbury and for actually me to have input from people that are more in tune with strategic planning. So I welcome any help I can get on identifying tasks at hand and the follow-through with it. So I appreciate all the feedback that I did get on it. Next up, new business is the SMMR2. There has been a recommendation to have a committee for the SMMR2 that was approved last meeting. And we need to come up with a mission statement, a scope, to help with phase 1 of this program. Anyone interested out in the public, please let me know. We'd like to have at least one board member on the committee, and I'll be reaching out to members of the select board to see who may be interested in being on that committee. Moving right along. Next up is for Selectmen's update. On Thursday, January 22nd, the 21st class of honorees were inducted into the Connecticut Veterans Hall of Fame. One of the inductees was Southbury's own U.S. Army veteran, 101st Airborne Division, Ken Curso. The ceremony was held in the Gold Star Family's Memorial Auditorium at the Connecticut Department of Veterans. And for those that don't or aren't familiar with Ken, he is a highly decorated soldier, having been awarded 2 Bronze Stars of Valor and a Purple Heart, among others, during the Vietnam War. His continued service to fellow veterans includes being the commander of the George Newton VFW Post 1607. He and his wife Mary have been active in our community for a number of years. We're honored for not only Ken's service to our country, but also the impact he and Mary have had in our community on an annual basis. Congratulations on this well-deserved honor, and thank you for your service and leadership. Southbury Police Department has celebrated its first anniversary as an independent police department on January 27th. Our officers accomplished a great deal in their first year, as exemplified by achieving the Tier 2 accreditation. Our independent police force is an admirable example on law enforcement building community relations and community trust. One recent example can be found on the police Facebook page. They went above and beyond the call of duty by coordinating a memorable time for a local family whose son is being treated for cancer. Please take the time to view the post. It shows how much our officers care for our citizens. The police department also rolled out a new software program called Viper 7, which is a 9/11 call-taking software program used in dispatch centers to manage emergency calls, which connect directly to emergency responders. Recently in the news, there was Public Act 490, which last October, the state of Connecticut did a reevaluation of farmland. The initial assessment values set would have increased local farmers' taxes some 200 to 300% on an increase. On January 15th, I met with 3 local farmers concerned about the proposed increases. The meeting was productive, and I assured them at the time our local government would be supportive in reducing the proposed increases. Fortunately, Governor Lamont considered the impact, reconsidered the impact these increases would have had on farming and reinstated the 2020 land values. There are ongoing efforts to cap future increases and provide more representation for farmers in the valuation process. Having worked on the Southbury Training School farm in my youth, I do understand the importance of farming and will continue to support our local farms in the future. It's a difficult job, but an important livelihood that doesn't get the support it's deserved. On January 27th, I had my first coffee with the first Selectmen at the Senior Center. It was a great opportunity to connect with Senior Center members and listen to everyone who attended. Great engaging conversation and questions. The next Senior Center coffee with the first Selectmen is scheduled for February 17th. Seating is limited and signups are required. Southbury was also awarded a 5310 grant for a new 12-passenger bus. Senior Services Director Andrea Kokorian attended the Connecticut DOT meeting regarding the transfer of the bus on January 21st. This new addition will be a valuable addition for our seniors to help with transportation reliability. I was also invited to tour the Gary 9 facility here in Southbury. The company is located on Main Street South. They fabricate numerous items of prototypes and also produce EV car chargers. We are gathering additional information and estimates for possibly installing EV chargers at town buildings. It was a pleasure meeting the owner and the staff, and there's more to come on those. Reports from liaisons, Selectwoman Wendy Bernard.
Thank you. So I'd like to start by just saying IPOC has not met yet, but we do have a scheduled meeting for February 11th, which I will attend and report on thereafter. And on to senior services, a special thank you to Judith, who oriented me and has helped me to gain my footing and understand sort of from the ground up, and I felt very prepared for my first meeting, and I don't think that would have been the case without her assistance, so I really do want to express my gratitude for your generosity of time. So today was the Super Bowl, SOUPER, bowl party. It was lots of fun, right, at these, at the senior center. And I played a lot of games. I lost everyone, just, being clear, but it was so much fun, and it was well attended. And, certainly I learned a lot also, even though it was a social gathering, and I did come away with specific words of gratitude for your attention to their interests and their expressions of, gratitude for the work that you have been doing, even just having taken over this position. Specifically, they talked about, the staff talked about areas of the center that hadn't been attended to in terms of improvements, even simple things like painting, repairs, and so forth. and the improvements are noted, long overdue, and greatly appreciated as well. One thing that I wanted to also mention, just specifically because they do have a need for some assistance. For example, there is just sort of in terms of the scope of work that goes on there, there's about 100 phone calls per day, about 63 unduplicated check-ins each day. Overall attendance, averages about 117 people, and there are about 755 members as of today. And there are roughly about 40 different activities per month. And so the current staff really believe that having someone who can assist in the sort of administrative component of having people, once they're coming in, being attended to in a manner that increases the efficiency of the programs and the information and services that people come to the senior center for would go a long way in helping them to do their more substantive tasks of even achieving greater levels of service to the community. So with that said, I look forward to my next meeting, and I look forward to the next event. And if there is anyone, I'll just put a really shameless plug. If you know anyone who is willing to support or sponsor any of the activities of the senior center, please do let them know. They would be greatly appreciated. Thank you.
Thank you for that. Just to elaborate a little bit further on it, some of the repairs that are being made, there were some areas, the meeting room and the reading room, carpet was really stained with some coffee spills and everything else. So we are taking the carpet out there and replacing it with vinyl flooring in both rooms. Also painting the walls, took down some chalkboards that they actually don't use at all. We are in the budget process. Andrea will have her opportunity to state her case on the need for a part-time administrative assistant. So we'll definitely listen to what she has to say. Selectwoman Kathy DeCarly.
Yes. The library is meeting next week, so I will have a report next week. Also, the tiny art show will be unveiling itself next week. I have an art piece in there. Kelly has an art piece in there. Mine features my cat. I recommend everyone going down. It should be a good time. It's a very cute cat. So I'll have a better report for library next week. I did meet with the Energy Task Force, and it was by Zoom, which was a surprise to me, but it was by Zoom, and they're going to be collecting some information, basically a bunch of data points, so they can do some analysis to see where the energy is being used, because we can get into a program where if we can, and this gets kind of technical, and I apologize, it was my first meeting, and I'm desperately trying to catch up here. But with some data analysis, we can enroll into a program, in which case Eversource will work with us so we can get some better rates. But we need to know how much energy is being used where, so that we can make a deal. And they're going to be doing a lot of that. They're going to be working with Dan Colton to access the account so we can get the data available so that we can get into this management program. They finished the investigation to request the carport canopies for Tim. And that's kind of it. So that's.
Okay, thank you. Selectwoman Kelly Keenan.
Okay, so Parks and Rec meets on Thursday, the 19th, but I wasn't talking to Megan, and she said that the subcommittee for the Ballantine Park improvements has still like you said, been working on pulling together different options to establish a scope of work so that they can put forth a formal proposal. So I would expect to have a more robust update at the next meeting. LEPC meets next Wednesday, the 11th, and that'll be my first meeting for that one. And then for Economic Development Commission, they're still looking at various ways that they can be involved with the America 250 activities. Commissioner Mary Corsu plays a big role in the America 250 planning, and so she's been keeping the EDC apprised of what they've got planned and how the EDC can maybe plug in and support those activities. They're also looking at CT tourism as a vehicle for promoting different activities in Southbury. And they got a preview of the proposed development at 333 Main Street South, which I believe went in front of the Planning Commission recently. So
Today.
That was quite a bit of conversation around that as well.
Thank you. Selectman Holly?
So Region 15 did meet on the 27th of January, of January. Normally they meet on a Monday, but they met on Tuesday. So every year they come out with this data report, and the data report is massive. Like, it's every metric you could possibly imagine, from classroom ratios to how kids are performing on standardized tests, even like live birth rates in our region and forecasts of live birth rates. So enrollment is actually a little bit down right now, but they expect that that will level out over time. So a lot of time was certainly spent on that, because there's just a massive amount of data, and the presentation is available online if anybody is interested in statistics in particular. And the other notable thing that they did is they made a transfer of $1.3 million for roofing repairs for Long Meadow. Obviously, keeping stuff in good shape. So that was their report. They were also planning to do a retreat on February 9th, but I believe that that's been canceled.
Thank you. Is Jason on? No? That's all we have. Can I get a motion to adjourn?
Sure.
Thanks, Kathy. Second? Was that Kelly? For the minutes? Holly for the minutes? All in favor, signify by saying aye. Aye. Thank you.